Boy, thank you, sir. Well, today in our Ask the Doctor segment, we are looking at different screenings for women that are so important. Dr. Talia Gates is an OBGYN with Walker Women's Specialist. She joins us live this morning by FaceTime to talk about a number of these issues. Dr. Gates, good morning.
Morning, how are you?
Doing very well. Good to see you. So when we're looking at screening for women, and a lot of that has to do with, of course, cancer. So what are the top 5 cancers that women need to be concerned about?
The top 5 cancers in women are breast cancer, thyroid cancer, uterine cancer, lung cancer, and colon cancer. So those are the top 5 cancers that you could catch as a woman.
And the screenings for all of them are, some of them are easily detected. Some of them, I know at least one cancer for women is not detected, correct? Easily detected.
Yes. Ovarian cancer, although not one of the most common cancers, or the top 5 cancers, it is on the top of cause of death from cancer from women. And ovarian cancer is not does not have a good screening protocol. That's one of the things we actually check for when you come to your annual exams. When we do an exam, we're feeling for masses, lumps, bumps, talking to you about different symptoms that could trigger us to look further because there isn't a good screening test for ovarian cancer.
Boy, and that makes those regular checkups even more important, doesn't it?
Yes, ma'am, it sure does.
And if women are, I know we all put things off, and we've talked in the past about people kind of putting off their checkups and their exams because of COVID, just kind of trying to wait this out.
Right.
But it is going to be a while, obviously, before anything feels like it's back to normal. So what is your advice to any woman who's been putting it off?
Well, so most doctors' offices, I know our offices have very strict protocols in place to keep you safe, keeping visitors down, keeping number of people in the office down, keeping the waiting room. So you should call, if you feel uncomfortable, you should definitely call your doctor and see what protocols they have in place, because we want you to come there. We can set up your mammogram, we do breast exams, we screen for thyroid cancers just by a physical exam to see if we feel anything abnormal. We do your pap smear, which is a screening for cervical cancer. Another thing that is, if caught early, can be prevented, because we can see abnormal cells there that may one day become cancer, but if we can address them now, you can prevent having to go through that.
And when you're looking at, if you do have a cancer and you are blessed and survive that cancer and go on with your life, are there certain things that women can do differently? I know cancer is such a mystery still, why somebody may get it and some people may not. But are there things we can do to try to help in that department?
You know, everything, like you said, is such a mystery. Obviously, always a healthy lifestyle. Colon cancer, for instance, you have an increased risk of it if you have a high-fat diet, you know, and so in making sure you're eating healthy, staying, you know, as regular as you can, that's one of the things that can prevent it. Smoking, obviously, we all know that smoking increases your risk for not only lung cancer, but it actually predisposes you to cervical cancer as well.
Oh, wow.
There is a vaccine out there to help prevent cervical cancer. It's called Gardasil. It's very safe, and that's something you can get for both boys and girls super early. You know, talk to your pediatricians about that. And it's actually up to 45 years old, you can get Gardasil now. So that's another thing you can do.
Now, I know you mentioned smoking, of course. I think everyone knows the dangers of smoking, but so many people are vaping these days. Do we know enough about vaping? I know people say it doesn't have the carcinogens in it, but what do we know about that?
We just don't know enough. We do know that it's addictive. It still has nicotine in it, and it can still, you know, ultimately cause damage to your organs because it's a foreign, you know, toxin in your body. And so we probably don't know the long-term ramifications, but I still think I would avoid it at all costs.
Yeah, I mean, I know a lot of people have turned to it to try to get off of cigarettes, but we know a lot of younger people have started doing it and it's become very trendy. So I guess that's the concern.
Yes, absolutely. And, you know, those are things that over years we'll have to see what the research shows. But, you know, it's still a toxin in your body. So avoiding any type of that can be beneficial and preventative, obviously.
All right. One final question. At what age should a woman be looking at getting the regular, I know as early as a teenager, you start getting your regular
Right.
exams, but other screenings, what are we looking at?
So the American Cancer Society and ACOG, which is at American College of Obstetrics and Gynecology, recommend 21 you start your Pap smears, at 40 you start mammograms, and at 50 you start colon screenings. Now listen, all of that is individualized though, based on your family history, your predisposing factors. So you need to get in and talk with your doctor. African American populations, this should start colon screening earlier, for an example. You'll start it earlier if you have a first or second degree relative that's had colon or breast cancer. So everything is going to be individualized to you. So that's why it's so important that you go and talk to your doctor about your personal history. But 21 for sure, you need to be in seeing your OBGYN.
All right, Dr. Talia Gates, thank you. Good to see you this morning.
You too. Have a good day.
Take care. You too.